The Coronavirus Antigen Rapid Test Cassette, Swab Specimen, Test Procedure. Allow test materials and specimen to reach room temperature before testing. The kit is composed of the test cassette, buffer, workstation, extraction tube, sterile swab, and package insert. Read the package insert carefully before use. Insert the test extraction tube into the workstation provided in the kit. Ensure that the tube is standing firm and reaches the bottom of the workstation. Add 0.3 milliliters, about 10 drops, of the extraction buffer into the extraction tube. Use the nasopharyngeal swab supplied in the kit. Carefully insert the swab into the nostril of the patient, reaching the surface of the posterior nasopharynx. Swab over the surface of the posterior nasopharynx. Rotate the swab several times. Withdraw the swab from the nasal cavity. Insert the swab into the extraction tube, which contains 0.3 milliliters of the extraction buffer. Roll the swab at least 6 times while pressing the head against the bottom and side of the extraction tube. Leave the swab in the extraction tube for 1 minute. Squeeze the tube several times to immerse the swab in the sample extraction buffer. Securely insert the dropper tip into the opening of the extraction tube. Remove the test cassette from the sealed foil pouch. Do not open the pouch unless you are ready to begin the test. Place the test cassette on a dry, flat surface. With the dropper tip facing the sample well, labeled S, hold the extraction tube vertically. Add 4 drops, about 100 microliters, of the sample by squeezing the extraction tube into the sample well. Start the timer. Read test result in 15 minutes. Do not interpret the result after 20 minutes. Interpretation of results. A positive result is indicated by the presence of both control line, C, and test line, T, within the test window. A negative result is indicated by the presence of only the control line within the result window. If the control line is not visible within the result window after performing the test, the result is considered invalid. Review the procedure and repeat the test with a new test cassette if an invalid result appears. Warning: this product is intended for medical professional use only and not for at-home use. Please read the package insert carefully prior to use. Antigen is detectable during the acute phase of infection. A medical professional should observe symptoms and epidemiology of patients in conjunction with this test result.